there might be some other types of medications that you don't want to give that could make it worse. So these are all important elements in terms of, and we're trying to teach doctors how to recognize these, because honest to gosh, a lot of doctors don't know that these differences exist. So that's part of what we're doing today, is also what we're trying to do with medical doctors. So what you're seeing today is very similar to a presentation that I would give to our physicians. So one of the questions then is that, okay, if I have cognitive impairment and it's mild, well, what are some of the predictors? What can we think about that might influence the conversion from minimum cognitive impairment to a true dementia? And so obviously age, the older you are, the more likely that this might be converted into dementia. And there's other subtle abnormalities that come from what we call neuropsych testing. So these are generally done by a psychologist, and they're just a lot more subtle type testing. And these just are examples. But I think importantly for all of us to understand that if somebody loses their ability to, for instance, pay taxes, they're not doing too good at balancing the checkbook, or they've lost money because somebody scammed them out of the money. These could all be signs of what we call instrumental activities of daily living problems or deficits. And that also could be associated with this minimum cognitive impairment condition. So some of the other elements is that if you're depressed, you have apathy, or if you have anxiety or just not feeling blue, and this is a Pablo Picasso blue woman, that kind of represents that whole condition. And so it reminds me of one of my geriatric doctors whose grandmother just turned 106 years old, and they asked her, so how have you been able to live to 106? And she says, oh, I'm happy, and I choose to be happy. And I think that would be a true statement, that individuals who have depression and low mood tend to be a setup, and whether they're cause and effect, I don't know. But people who are not happy tend to have a higher risk for acquiring minimum cognitive impairment. And sometimes, just to be honest with you, sometimes the depression is so bad that there is memory loss. And so that's why we go through all these different types of tests and evaluations to try and figure out whether the low mood is part of Alzheimer's disease or whether it's a condition of depression on its own. So it turns out that when I look at individuals, if they're walking slow, that I start to think, well, if they're walking slow, maybe we have to do some memory testing, because it turns out that if you are a slow walker, there's a twofold or 2 times increased risk of developing dementia. So I just wanted to point that out. Some people will use the smell test, and they found that people that don't smell very well might have a higher risk of being predisposed to dementia. I honestly don't know where this fits in with the COVID pandemic, because as you know, 60% of people who get COVID lose their sense of smell. I don't mean to suggest that there's a relationship between getting COVID and dementia, but if you're using any type of clinical testing, for scent or olfactory function, it may be messed up a little bit with this COVID pandemic. So I just point that out in terms of the research that we're doing with Alzheimer's. So one of the other big questions for research is whether there's any blood markers or brain markers or spinal fluid markers that might identify people who have minimum cognitive impairment who may go on to get dementia. And so people have looked at this genetic marker called apoprotein E4. So it does have an association with dementia if your family carries the ApoE4 gene, but there's no connection between the conversion of minimum cognitive impairment to dementia. So the big deal with ApoE4 is that knowing that you have it means that you're you've got a lipid or a cholesterol system that's a little overactive, and so you would want to manage your cholesterol levels very, very aggressively. So in terms of any type of diseases that are linked with minimum cognitive impairment, one is the metabolic syndrome and diabetes. So those are people that are overweight or have sugar problems. And so there is a higher risk. So that's what means HR hazards ratio, or a higher risk for getting memory problems associated with this so-called minimum cognitive impairment. So good, strong control of, so you can apply from this two things clinically. One is weight loss, and good control of blood sugars are two things that would be important as a way to prevent further progression of cognitive impairment. Yeah, and then there's just a bunch of other markers in the spinal fluid. Not much to say about that. This is all research oriented, so I really don't have much to say about that. In terms of brain images, so we often get CAT scans and so-called MRIs of the brain. Again, there's not a whole lot to really talk about. What some people find is that there's what we call temporal atrophy. So you can see these arrows are pointing to areas that progressively look like they're shrinking. So on the left is a normal brain, and then on the right you can see these high blackened areas, and so that might be an indication of ongoing cognitive impairment. One of the things that this slide reminds me of, looking at all these squiggles, is that there was a study in Europe that found that over a 5-year period, that people that had a meat-heavy diet versus people that were more fish-oriented and vegetable-oriented, that the people that were heavy on meats had this brain atrophy occur over a 5-year period of time. So it's just kind of interesting that your diet can actually influence whether your brain shrinks or not. And so that really fascinated me. Yeah, so there's other additional tests that we're doing. So we're looking at what we call PET scans. And sometimes a PET scan is a little bit more sensitive in detecting memory disorders. So in terms of how we work up somebody that does what we say screen positive for minimum cognitive impairment, is that we try to always look for reversible causes of why the brain is not functioning properly. So the first and foremost on this is to look at the medication list. If you're taking something like Tylenol PM, which has Benadryl in it, if you're taking what we call benzodiazepines like Valium or lorazepam, or you're taking any type of sleeping medications, or if you're taking chronic high dose pain pills, opioids such as Tramadol, Norco, all of these medications can cause dementia. And so we need to identify those and try to find alternatives to these medications that dull the brain and can cause progressive memory loss. The other point here is point number 2, is that sometimes people start having memory problems with what we call obstructive sleep apnea. So that's in the middle of the night where you start having snoring, and then there's a stoppage of breathing for a few seconds. And then all of a sudden somebody's kind of like gulping air, somebody starts breathing again. And so that's called sleep apnea. And then also low mood is a reason for memory loss and other forms of cognitive impairment. And so just trying to identify that and treating that is often a key intervention. In our clinic, when I look at folks for problems with memory conditions, I always look for whether there's a decline in vitamin B12, and then also whether there's an underactive thyroid. So those are pretty much the clinical evaluations. Some of the other tests that we do these are standardized tests. This one on the left is called the Montreal Cognitive Assessment Test. The other one below that is the one that I use, is called the SLUMS test. kind of sounds crazy, but it's called the St. Louis University Mental Status Test. And the scores that indicate minimum cognitive impairment are scores of 21 to 26 out of a total score of 30. And it's pretty rare for people to get a perfect score on this. So that just goes to show you that, you know, you can miss points on these tests. And I don't want to talk too much about these rapid screens. These are for doctors and nurses to use in their clinic as a quick checkup. So these are pictures of, you know, these tests. So I use the one on the right. It was developed out of the Veterans Administration. So that's why it has VA MC, which stands for VA, Veterans Administration Medical Center. But it's a very good test that helps us identify memory problems, problems with drawing a clock, and problems identifying figures, and then also some storytelling and remembering parts of the story. So now I want to turn now towards treatment and just talk about some things that we can do. So one of the things is that we know that good blood pressure control, and when I talk about good blood pressure control, I'm referring to a systolic blood pressure of 120 to 130. Most providers, nurse practitioners, and physicians say, oh, if you have a blood pressure of 140, that's good enough. I think new information is suggesting that that probably is not good enough and that we need to be a lot more aggressive with controlling blood pressure. And so this comes from what we call the SPRINT trial. And the SPRINT trial identified that people with very, very good blood pressure control, closer to 120 millimeters systolic blood pressure, lived 3 years longer than those that had 140 systolic blood pressure, and they had less cognitive impairment. The other thing that to aggressively address is cholesterol management. And so again, if somebody screens, you know, and has a minimum cognitive impairment diagnosis, we would want to make sure that they have pretty good cholesterol management. I already kind of made a mention about nutrition, and so the Mediterranean diet, or there's something called the MIND diet, which is basically the Mediterranean diet combined with what's called the DASH diet. So it's an Mediterranean diet coupled with low salt diet, basically. That those diets may have a good impact in preventing the progression of MCI, minimum cognitive impairment, to true dementia. So I always advocate for Mediterranean or a whole grains, vegetarian with a fruit forward diet. Basically, no meat. Fish is good. Although I have to tell you that there's one fellow who, you know, kind of good news, bad news. He had tingling in his fingers. He had tingling in his feet, and I asked him if he worked on a farm, and he says, no, but he said he did a lot of fishing and he ate walleye every day. He loved walleye. And I said, well, you know something, I got kind of good news and bad news, because we did a test for him and we found that he had very high levels of mercury, which was probably from all the fish that he was, you know, that he was eating, all the walleye. So I said, the good news is that you can still go fishing, but the bad news, you can't eat all the fish that you've been eating. So that was the moment of revelation there. The other thing that I wanted to mention was that physical activity is so important, and people that actually have this minimum cognitive impairment will start to improve their that testing that I showed you, that slums test or the Manocha test that I showed you, that if they do aerobic training, that's, you know, kind of getting your, you know, bicycling going or your walking going, those are important ways to improve your memory. There's also what we call cognitive training programs. And so those are available. And they also include things like doing memory games that are helpful for improving memory. One of the other comments that I like to make is that in terms of treatment for minimum cognitive impairment is what we call dual task training. So this is important because as people have problems with their memory, they also have, as I mentioned, problems with their walking and with their gait, and so they're at a 2 times greater risk of falling. And there are ways to try and prevent that falling. So one of them is called dual task training, and that's where, like this gentleman that you can see in the background is walking, but what you want to do is count backwards or do something to engage the brain. You can spell letters, so or words. You can say while you're walking, spell the word yellow. Whatever it is to activate the brain while you're walking is called dual task training, and that forces the spinal column to become more involved in gait and balance than the brain. So that's why you're doing those number countings. You can say the alphabet backwards. You can say it forward. Just get something for the brain to be activated. So what's not recommended under these conditions is to use the Alzheimer's drugs. There's no impact on things like Aricept, rivastigmine, galantamine on these on what we call the conversion from minimum cognitive impairment to true dementia. And so it also is interesting that what we call nonsteroidal anti-inflammatory medications, things like aspirin, Motrin, and so forth. There's studies that show that people that chronically take these for rheumatologic conditions have lower risk of Alzheimer's, but yet when they did studies on people taking these after they've developed minimum cognitive impairment, that they don't really show there's any effect, and there's really more side effects with these medications over the long run. So again, aspirin-like compounds are not recommended. And in fact, new evidence suggests that low-dose aspirin, unless you have heart blockage or risk of stroke, that taking aspirin on a regular basis is not indicated anymore. So it turns out ginkgo is prescribed for everything. Turns out ginkgo can lower your blood sugar by 25%, so that may not be such a bad thing, but it did not show any benefits in those individuals that already had minimum cognitive impairment. And there's other things that people have used. They've used fish oils. They've used high dose vitamin B, so B12 and thiamine. None of those really seem to have had much impact. However, there are some promising research. People are using intranasal insulin for what they call amnestic or forgetful minimum cognitive impairment. They're using types of growth hormone. So these are all research studies. And then people are also using turmeric. And here's a bunch of turmeric roots on the right. And they find that there's improvement in both verbal memory, visual memory, and attention tasks. I just got a box load of 3 pounds of this stuff, turmeric, at my house from Amazon. So it drives my wife crazy because I get all these roots and I've got to peel them and scrape them up, and then I put them into my smoothies. So just want to talk a little bit about some of the different stages of dementia, and this just shows that a artist who had early dementia, you can see how he painted himself or drew himself over time, and it really starts this just reinforces the idea that the way the dementia works, that you start seeing things so differently over time. And so I just want to conclude here, and I'll answer some of the questions we have trying to develop what we call a dementia-friendly environment, and that starts with both the in the clinic, just training doctors and nurses how to better recognize memory disorders. I mean, I have to tell you that one time when I first came to North Dakota, I was trying to be a good doctor, and I saw a lady who was in her late 80s, and she was complaining of hip pain. And so I looked at her hip, and then I said, well, now I have to do some memory testing. And she just went bonkers. She says, why are you testing my memory when I have hip pain? So I think, it's a good story to tell in terms of, always being ready for doctors to be comprehensive and really doing what I call the soup to nuts workup. So let's just take a look at some of the questions. And so I'm just going to go down the list here. Oh, so somebody asked about the curcumin or the turmeric. How much should you take? So we don't know the answer to how much you need to take for preventing progression of Alzheimer's or to prevent Alzheimer's. The studies show basically in animal studies, it's 50 milligrams per kilogram. So for humans, that works out to about 1 gram of turmeric twice a day. So a lot of times they make these pills in 500 milligrams. So what I tell people is it's 2 pills twice a day. The only clinical commentary that I would make is that if you're on blood thinners, you probably don't want to take turmeric because it can interfere with your blood thinner. Can you repeat the medications that contribute to memory problems or dementia? Yeah, so medications that there's a lot of them. And so it's really up to your doctors to make sure they're not prescribing all these medicines that can cause memory impairment. But anything that, if you're taking anything other than melatonin for sleeping, that's going to affect memory. And it affects memory in a couple of ways. Lunesta and Ambien are good examples. These are what we call benzodiazepine-like medications, and they tend to reduce what we call REM sleep, so that's the good sleep, and they also induce what we call amnesia or forgetfulness. And in fact, it's been a treatment that airline pilots use when they do overseas flights, is that they'll take a medication such as lorazepam so they can reset their brains in a sense. It totally affects the brain rhythm. So that's one category. And then there's any of the what we call opioid medications that over the long term, there's some very profound loss of cognitive ability on long-term use of opioids. And so, I've had a lot of patients say, oh, I take some tramadol at bedtime, and I've been doing that for the last 5 years. And then you find out that they've got some short-term memory loss that it may very well be related to that medication. And then other parts of the medication list is what we call anticholinergics. And so medications like Benadryl, Tylenol PM, some of those what we call first generation antihistamine medications can over the long run create memory loss. And then finally, the other medications that can contribute to memory problems are things like Flexeril, these muscle relaxants. Those in the long run are not very good medications. So somebody's mentioning here, Dr. Holloway, I guess, says attitude does affect behavior in the mind. So that's a good point. Yeah, so optimism and appreciation are healthy ways to think. And so as I said, kind of referring back to my colleague's grandmother, who said, I choose to be happy. And so I think that I often tell people to live to 100, you need 100 laughs a day. So there's a lot to be said for that people who live long, healthy lives tend to be on the happy side of the equation, not the grumpy side. So somebody also asked, does growth hormone receptor hormone have any bad effects? I don't know that much about so-called GHRH to really give you good feedback. We can get back to you on that. The manipulation of growth hormone does have side effects with, particularly with the wrist and causing carpal tunnel syndrome. And so there are some, anytime you manipulate the hormonal system, there are some potential side effects. But to be more specific than that, I'd have to go to the research study and actually see what the side effects have been noted. So another question was, are there any insights on good cognitive training programs? I don't have an opinion, quite honestly. There are online cognitive training programs. There are cognitive training programs that are through psychologists and through Alzheimer's programs. So I didn't show all the resources here, but you can go to the Alzheimer's Association for questions like that, and also to the National Institute of Aging has a website. They also provide resources for different types of cognitive training. But again, I don't endorse anything. I actually tell people, just to get jump started, if you just simply take a deck of cards and identify pairs of, let's say, aces and queens and kings, and you put them down on a 3x3 grid and try to flip them and then try to remember where they are. So like a memory game, that would be a good jump start. The other thing that I didn't really mention or emphasize, by the way, is that dancing has now been identified as a much higher impact on memory than any other type of exercise. And the reason being is that dancing, generally involves pairs, and that the dancing, creates a more lighter mood. It's social interactions. And so that it's a double whammy, is that you're getting exercise and you're getting social engagement. And so I was going to say to Marianne, I said, maybe in addition to our singing, we should be doing a little dancing in addition to that. So and the good news is that just about any dance works. I don't know if I'd recommend the tango, because when you do those dips, they could be a little bit of an issue for falling. But dancing turns out the research is showing that it's pretty good for just in general advantages for aging in general, and also for preventing Alzheimer's.
When we get back together, or when we get together, one of my dreams about the Memory Cafe was to have like a whole array of activities, and we got the choir started, but I would love to have a walking group, where we would meet at the mall in the morning and do walking exercises, and then have a Memory Cafe specifically for, or just a day or an event a couple times a month for art.
Yes, I think that's really good. So, any type of creative activity would be wonderful.
I've never had time to get that going, but it's on my to-do list.
Yeah, well, so we have a lot of things to do. We're actually going to try and create here in 2021 with our Dakota Geriatric Project an art contest to represent what we call age-friendly imagery. So we're going to invite North Dakota, South Dakota, and area artists to try to conceptualize, what would be considered age-friendly themes or topics. So stay tuned for that. We'll keep you posted. So does anybody else have any other questions? You can unmute yourself and ask questions if you want.
There's one on the side here that says, when a person has a memory loss dementia, should they have a certain primary doctor?
My answer would be yes, and that doctor should be very familiar with how to medically manage dementia. And that's part of our mission here, is to try to train doctors how to do that. So just to let you know, we did a survey of primary care providers. So that's nurse practitioners as well as doctors. And 2/3 of them really did not have much training in dealing with aging in specific, or with dementia care. So there's a lot of, believe it or not, they don't get a lot in medical school, and then they go to further advanced training for their family medicine practice. They all can understand, when you say dementia, they go, yeah, but then you ask them, how do you medically manage that? And then you kind of get this blank stare. So we're trying to improve that, and that's part of our mission, is to create, as our project here, the Dakota Geriatric Project, is to make sure that 100% of all the primary care providers in North Dakota and South Dakota better understand how to recognize dementia and how to treat it. And also to develop plans. So if you haven't had your annual wellness exam, as to what things you can do to prevent Alzheimer's, right? So that's all part of the annual wellness exam. And so, yeah, I think that people with an expertise in either geriatrics, and we're trying to develop more doctors who understand geriatric medicine. We have 2 doctors in training right now who are going to become geriatricians. One of them, unfortunately, is going to Oregon, and hopefully the other one will stick around here in North Dakota. But yeah, we're short of geriatricians, so that's why UND created a geriatrics program, was because we recognize the fact that we're about 40 doctors short of having enough expertise to work with people with what we call age-related syndromes or geriatric syndromes. So yeah, good question.
Dr. Jurivich, do you think there's a chance where that geriatric teaching could get incorporated into the medical student schooling?
Well, we certainly do our best. And just when you think you're making some headway, they go, we're going to change the curriculum.
I know, I get that too.
And so,
yep. But I'm glad to hear that you're actually teaching some of the doctors, because that's been the downfall for years and years and years.
Yeah. Well, in addition to it, so we're trying to do a lot of creative things. So to answer your question about the medical students, is that we are developing a game. So these younger students are always interested in games. So we're trying to do this so they can learn through gamesmanship, and we're finding out if it actually works. And it's got a lot of attention nationally. So Dr. Manocha is on this conference call. She's one of the faculty that's working with this and trying to move this forward. So I think University of North Dakota is going to have a little place on the map there, talking about geriatric education, and we're doing other things, right?
Good,
so
good.
Yeah.
I'm glad to hear that.
Can you talk a little bit about what those games would be like?
Yeah, so we're quite excited about the game, because what it does is that it allows the student, and it could be nursing students too, it's just not medical students. They actually become the, if you wish, the Mr. Molman from Altru, the CEO, and they say, you are in the game, you are now head of this hospital, and your goal is to make the quality of healthcare for older adults 65 and older not only better, but less expensive. And so they have to get several choices, and they march through the medical system, and they're giving different problems. They say, oh, here's a group of patients that are diabetic and they're not doing as well as we'd like them to do. So what kinds of interventions would you pick? I'll let the secret out of the bag with the group here, is that if the students select the geriatric 4Ms, those 4Ms that I talked about, what matters, memory, medication, and mobility, they're going to win the game. So.
Oh, nice.
Dr. Jurivich, could you speak a little bit about Prevagen? Does that have any actual merits or not?
I have not done a real, what we call, deep dive into Prevagen. And so I don't want to, say anything. I don't know, Gunjan, you might have read a little bit about Prevagen. Do you have an opinion?
No, not really. I'm gonna have to go through some recent literature to see if it actually shows any marked differences.
Yeah.
Okay.
So we know, for example, the topic that we're talking about, this minimum cognitive impairment, it will not have an impact on, for those, so half of the people go to develop, Alzheimer's, and the other half just go back to normal. So whatever the reason is, so Prevagen does not have any impact whatsoever on that. But, does it do any harm? I haven't seen any studies that says it does any harm. None of the geriatric doctors prescribe it. So
yeah, I think I've read one, I don't know, it was probably I don't know when the study was published, that showed that there were no
No
good
benefits, yeah.
effects. Yeah.
Yeah,
Yeah.
a couple
I mean,
years ago. Oh, sorry, a couple
I
years
was
ago.
just going to say, if given a
Yeah.
choice, I'm much more, as you might tell by my presentation, is that I'm much more convinced that turmeric has advantages, and it's based upon, because I go to what we call NIH study section, and I review grants and research, and so the most recent research is saying that this turmeric has a positive effect. So, you know, it's going to take some time for them to publish this information, but I'm kind of letting you know what I've discovered just from, you know, reading other researchers' grants.
We had a
yeah.
neurologist that talked to us a couple years ago, Dr. Roller, and he said that Prevagen is very helpful for the people that are selling it to make money.
Yes.
Could be true.
I hear an advertisement about that in medicine on TV. I think it's all for money.
Yeah.
Well,
Personal feeling.
for sure, I think, but you know, the popularity of turmeric has increased because a lot of people use it for arthritis.
Right.
And I know, you know, and again, I hate to use personal experience, but you know, I've got a bum shoulder, and if I don't take my turmeric, my shoulder really flares up. So it does work for arthritis in some people.
I
Yeah.
always say, I come from India, and I always say that there's two reasons you don't hear about Indians having Alzheimer's. So first is we don't live that long, and second is we eat everything with turmeric in it.
Yeah.
Our fish curry is our brain food. You get fish and you get turmeric.
So
That's a
I
good point. And actually, Dr. Manocha is bringing up a study that was done, quite a few years ago, that compared a group of people from Pennsylvania with a group of Asian Indians. They found that there was a tenfold less Alzheimer's in the Asian Indian population than there were in the Pennsylvania. So they always thought that one of the reasons is that the difference was because of the diet, which might include a lot of turmeric. So, but again, they're not eating massive amounts of turmeric, so I don't know if that's enough, whether it accumulates or, you know, there's a lot of research that needs to be done about that. And so I think really the current recommendations from the National Institute of Health are very, very good blood pressure control, physical activity, and using your brain. Those are the three main things. And the fourth one that'll probably come out is going to be nutrition. But again, they're not ready to, you know, take the bull by the horns on that one. But I really promote good nutrition. So Mediterranean diet in particular.
There's another question. Oops, I'm sorry. Go ahead.
Oh, I was just going to say, you would recommend the root and grating that rather than the pills for the turmeric?
Yeah, it's cheaper.
Oh.
If you get it on Amazon, it's a heck of a lot cheaper.
I've actually heard more and more about turmeric in the last 2 years. My sister claims that it helps for leg cramps, and my son's best friend, he's 35, he was born with spina bifida. He's had numerous surgeries, but he's been having a lot of issues with back pain recently. He's been going to a neurologist, and he's had been taking tramadol, and finally somebody got him started on some powder that has turmeric in it, and he said he's feeling so much better. I don't know how much powder he takes and I don't know, can't remember the name of the powder, but there's turmeric in there. And he said, even with bloating, it's helped with his bloating. He's able to move better. His mood is better. He feels so much better since started taking it. And I don't know how long he's been taking it, but.
Yeah. Well, we go through these different modes. My other pet project is beet juice. And so it turns out that a third of a cup of beet juice twice a day helps lower your blood pressure by 10 points. So I don't know if I can, that's the other thing that's driving my wife crazy. I've got beets all over the house. So I've got these orange turmeric roots and I've got big red beets all over the place. And even the dog is looking at me kind of funny.
Dr. Jurivich, there's a question. Does your group have any studies with local patients? Do you want to talk about HATS program very quickly before we move to the
Yeah,
next
thanks.
meeting?
And I'm going to have to scoot because I have a meeting with a faculty member here shortly. But yeah, well, actually, Gunjan, why don't you describe the HATS program? Because I'm going to have to, quite honestly, I have to sign off to be out of respect for this other faculty member. So I
Yeah,
want to thank everybody for joining our meeting today. And we look forward to your next meeting, and we'll have another topic to talk about.
Okay. Thank you, Dr.
Jurivich.
Jurivich.
thank you.
Yeah, thank you.
Someone has asked, does your group have any studies with local patients? And I think this is an excellent question for us because I want to make this announcement also. We have a program called HATS, HATS, Health Ambassador Teams for Seniors. So what we are doing, we are pairing interdisciplinary students. So one from medical school, one nursing student, one physical therapy, one occupational therapy student, and we are making their teams. And in presence of a faculty, these teams perform complete geriatric assessment. So these teams perform complete geriatric assessment for a volunteer patient. So for example, if you volunteer for it, you get a 1 hour of, it takes 1 hour for this whole interview that includes all the aspects of a annual wellness exam. And then after this 1 hour, the teams meet with the faculty, they discuss your test results, so to speak, and also follow up with the healthcare plan. So for this, we are always looking for volunteer um, patients and volunteer older adults. So if any of you are willing to um, volunteer your 1 hour of your time, and this happens over Zoom, so you don't have to travel and you don't have to meet us anywhere, so it's socially distant. So this is our effort to teach interdisciplinary teams of students on not just older adult care, but also how to do it through telehealth. So this is one of the major studies that we are doing. And if you want to be a part of it, just let either Marianne know or any of us in the geriatrics department know, and we can set up a schedule.
Gunjan, there's a question that came across. Do you recommend a baseline cognitive assessment early on to use as a measurement for later testing at any specific age?
I am not a clinician, but I note down this question. I see that Lynn's question, right?
Right, yep.
And I will get back to you on the answer, and I'll check with Dr. Jurivich and, get this answered.
Okay. One question, and I'm not sure if I'm answering this correctly or if I'm reading the question correctly, but the doctor who would do the neuropsychology testing is Dr. Thompson here in town. She's at, I want to say, Midwest. And she'll do the neuropsych testing to get a diagnosis of dementia. What we found, and the reason the Memory Cafe started is because we had a heck of a time deciding what kind of doctor do we go to, who takes care of people that have dementia. And we ended up finding a really, really good neurologist at Altru who handles the neuro part of handles all the, like the medication and stuff for the Alzheimer's or dementia. And then she works really closely with a family doctor that we have. We have Dr. Millette, but there's others that are very, very good also. And the two of them work together just wonderfully. And we've been very happy with that. So you really need a team of people to do that. And if I didn't answer the question right, or if you have something else, you can send me another message and chat. But I'm hoping that's what.
Yeah, so could you explain again the focus of volunteer test program? It's to get your annual wellness exam performed by students, our students. So there'll be a student from medical school, a nursing, PT, a physical therapy, and occupational therapy student, and they will perform your annual wellness exam and also follow up if they have a health plan for you and if they want you to reach out to your doctor about something or change something, they will follow up with you. And this is a volunteer program because uh, there's no Medicare involved, there's no insurance involved. This is strictly volunteer. And Mary has the flyer, right? Uh,
I do,
I think-
yes. Yep,
yes.
yep, I can
Do
send
you
that out
mind
to
just
everybody.
emailing everyone the flyer, you know?
Yep, I can do that.
Yeah.
Happy to. Anybody else have questions?
And also we are always, Mary and I will be looking at organizing a monthly Zoom meeting. So if you have any topics that you would like us to cover, just let us know. If you have something that you really want to talk about, or have Dr. Jurivich, or we can also organize other speakers, but have someone talk about a specific topic, just let us know.
Okay. So if you want to stay on and chat for a little bit, we're happy to do that. Otherwise, we'll end the meeting so people that have to go back to work and stuff can leave. But we were having a really good visit before. Beforehand, I came on about 12:30 and people joined me, and we were having a great visit. So feel free to stay and we'll chat for a while. And otherwise you can go ahead and sign off. Or
Bye,
hit
Mary.
leave.
Thank you all for listening to
You're
us.
welcome.
Very much.
Thank you.
Good to see you all.
Good to see you. Yay.
Thank
So
you.
Are you the leader for Memory Cafe in Grand Forks?
I am, yes. Yep.
Can you put us on your email list or something? We would love to,
Oh,
be
okay.
attend your meetings too,
Yep.
especially when you have these kind of special events.
Right. Would you send me your email address? You go down to the bottom and where chat is,
That,
and then
okay.
just type your email address and I'll send you to my Memory Cafe list.
Okay, yeah.
Yeah. I thought you guys were new, and then it's like, when he was talking about mild cognitive impairment, I was a little worried that I could fit into that. I was
I
like,
think you're the only one.
I do that on a daily basis.
I know, right? Same here.
Yeah, this is starting to work out really good. I'm not a big Zoom fan, but we've got Judy here from Florida. She comes back to North Dakota when it gets warm out, and it's like, this is great. We've got some new people that have joined us, and yeah, thanks.
It didn't come out right. I have to do it again.
Yeah. So how is everybody doing? Locked in? And we've got a couple of people I found out that have been able to get their COVID shots. How about
Virus.
others? Are you guys doing okay? You learn to live with the disease in the community? Steve, you're pointing your finger down. Are you having trouble? You have to unmute. You can unmute and talk here.
Let me see.
There you go.
Yeah,
Oh, here.
There you go.
I don't know if it's political or not, but I've been having trouble sleeping.
Yes, me too.
That's
I've learned not to watch the news before I go to bed.
it's the truth.
Yeah, political stuff has gotten kind of crazy,
Scary.
scary, yeah. So I told my dad, I said, okay, this is something I never ever thought first of all, I didn't think I'd ever see a pandemic. Second of all, I never thought I'd see the Capitol in the United States attacked.
I know, right? Here we're always worried about third world countries or Afghanistan, and now our own people are doing it. Isn't that sad?
Yeah, so I'm tired of living through unprecedented events.
Yeah.
Right.
I want to go back to my regular little life where I felt nothing bad was going to happen. Yeah. Have you guys? Do you know has anybody else been able to get their COVID shots yet, or do you have questions about them? Oh, Sharon, can you unmute, Sharon?
Oh,
We got
yes,
ours.
I did. We are on a list.
Okay, good.
And we got ours out at Altru, and it was just real easy, nothing to it. So,
Did you just go to your doctor?
no, I
No,
got
don't
it
go to-
on.
Don't
Yeah,
go to
go
your
ahead.
doctor because you'll end up with a second flu shot. Somebody went to their doctor the other day and the doctor's nurse gave them a flu shot. Now they have to wait 3 weeks before they can get the COVID shot. So,
Oh, no. Yeah.
yeah, she just went in, she said, well, I'd like to get a shot. And so they gave her a flu
Oh,
shot. It's like, oh
oh,
no.
oh dear.
Oh,
Yeah.
no.
Surprised the nurse didn't ask her what shot she's here for, really?
I said the exact same
Crazy.
thing, yeah.
Yeah.
So the best way to do it is to either go through my chart if you have it, or call the COVID hotline. And does anybody need that phone number? I can look it up real quick. But they will send you, or they'll put you on a list. And then there'll be a couple different places that are going to be giving the shot right now. And one is at the south side at Altru, and the other one is at the Alaris. Altru has their own clinic, and then the Public Health is running the one at the Grand Forks County Public Health is running the one at the Alaris. They're both extremely well-run. You get the shot, they give you a card, they tell you when to come back for your second shot, that kind of thing. So, I would recommend either one of them. Just make sure you know where you're going when they call you for your appointment, that kind of thing. I think, I was gonna say they were usually calling within 48 hours, but it all depends on the distribution of the vaccine to the states, and the states have to get it to the cities and that kind of stuff. So
If you go into the Grand Forks Public Health Department website and you can get on there, and then you don't have to wait, you don't have to make the telephone call, which is sometimes a long wait. But
Yeah.
when you go on there, then you can click on and they will show you all the times available. And then after you pick a time, then they will send you a confirmation. It's really easy if you have a computer.
yeah, I didn't know they had it on the public health website. I knew that, I guess we just went through my chart. Okay.
It comes across on Facebook Messenger. They'll send
Oh.
you the message on Facebook Messenger.
Oh, interesting.
Okay.
Mhm.
Mary Ann, did you get your shot too, or just Pat?
Pat got his, but I'm too young.
That's what I was wondering. I'm too
tried to-
young too. I'm only
I tried to get in as
only
Poor thing.
69, so I have to wait for the next phase.
I tried to get in as a nurse, but that didn't work either. I'm not working with COVID patients. So. But so I don't worry so much about myself. I worry about my husband and my dad. So, and they both got the first shot. So,
Okay, well, that's good.
yeah, I'm not as in a big a hurry as to get it myself.
Yep, I get it. I was just curious, as long as you were there, if you actually asked for yourself too, or just for your husband.
But they're also giving, it's for people over 75 right now, but they're also, if you're 65 and you have 2 or more like chronic health conditions, those people are getting vaccinated also.
So you couldn't get it because you were a caregiver then, huh?
No,
No.
not old enough. If I was over 75, I would have been able to get it, but I'm only 60. I know.
Maybe,
So sad.
but, you know,
I'm only 60. A couple weeks ago, I was crying about that when it was my birthday. It's like 60. Oh, I get to 60.
Oh.
well, thank you for it. And we're gonna log off here, but it was so good to meet all of you, and some of them I recognized from our Fargo Memory Cafe. But anyway, I hope I see you again. And
Please.
Yeah, good to see you guys.
Join
Thank
you.
you.
Thank you.
All right, thank
Love
you.
having you join us.
It was good to see all of you. And thank you, Mary Ann.
You're welcome. Good to see you, Sharon. Take care.
Very interesting. All right. Thank you. Bye,
You bet.
everyone.
Well, we'll see you
Bye,
guys
everybody.
next month.
Yep.
Okay.
Thank you. He's very
Thank
interesting
you.
to listen to.
You're
Thank you
welcome.
for having him.
Good to see you all.
Yep. Good to
Thank
see
you
you
so
too.
much. It was very good, very interesting. Thank you.
Yeah, he's a good speaker.
Yeah, for sure, for
Yep.
sure. Okay, so let's go. Let's leave. Maybe I can't leave.
I mean,
All
I
right, have
gotta,
a good weekend, everybody.
Oh, I didn't. Oh, there we go.
here we go.